Tonight, the Atlanta-based CDC is making some big changes to its coronavirus guidelines.
Well, the agency now offering alternatives to the recommended 14-day quarantine period for those exposed to COVID-19. CBS 46's Melissa Stern explains.
The CDC warned on Wednesday that this winter could be devastating.
The time for debating whether or not masks work or not is over.
Predicting that total deaths from COVID-19 could reach close to 450,000 by February, unless a large percentage of Americans follow precautions.
December and January and February are going to be rough times. I actually believe they're going to be the most difficult time in the public health history of this nation, largely because of the stress that it's going to put on our healthcare system.
The CDC is still recommending you quarantine for 14 days as the best way to prevent the spread of the virus, but introducing shorter isolation periods as alternatives. If people don't develop symptoms, the CDC says they only need to quarantine for 10 days. If they test negative, that period can be reduced to just 1 week.
Most people who get exposed to coronavirus will come down with COVID within a short period of time.
Officials say the new alternatives are necessary to reduce burden on both the public and the health system.
If we can reduce the burden a little bit, accepting that it comes at a small cost, we may get a greater compliance overall with people completing a full quarantine of, let's say, 7 days. If more people on board to complete that overall, that will result in fewer infections.
The UK is the first country to authorize a COVID-19 vaccine for emergency use. Results from clinical trials last month revealed the vaccine was 95% effective overall. It was also offered significant protection for older people. The CDC is recommending people stay home for the upcoming holiday season, just as it did before Thanksgiving. Reporting in Atlanta, I'm Melissa Stern, CBS 46 News.